Good morning. Thank you for joining us today. We appreciate it. My name is Scott Feinberg. I am on the board for Minnesota HIMSS, and we want to thank everyone for joining today and those that have been involved with our Executive Connection event that we're holding today. So thank you so much. Quick couple notes. We're going to be running the auction, as many of you have been bidding for those opportunities for the sessions with the executives, which we'll be meeting some of them today in our Fireside Chat. And that auction will be running through tomorrow at 12 noon, of which time we will be shutting it down and awarding the final winners with follow-up notifications coming. I'd like to turn it over now to our president-elect for Minnesota chapter, Betsy Keenan-Brown, to share a couple messages.
Hello, thank you everybody. Welcome. We're so glad to be here today with all of you. My name is Betsy Keenan-Brown. I am the current president-elect of the HIMSS Minnesota chapter, and I'm also the VP of the Office of the CIO at mHealth Fairview. Our chapter here has been hard at work, really trying to define and implement a holistic transformation that leverages all of our digital technology as well as to really just enhance that overall experience. And today's event is really a cornerstone around this fresh and innovative approach towards virtual programming. And so we're so thankful for your participation today, and we look forward to your future digital engagement as well. HIMSS Nationals also wants us to all be mindful that it is Global Health Equity Week. And so, we encourage everybody to think about these important topics and be an advocate, contact members of Congress, and advocate for some of these important aspects that we're facing in healthcare around telemedicine, maternal health, patient identification, and much, much more. Go ahead, scan that QR code in the corner, and that will get you set up on how to be able to participate in that work. And without further ado, I'm excited to hand things off to Sharon Kirby, who is our Chair of Clinical Informatics.
Thank you, Betsy. So yes, I'm Sharon Kirby. I today have my hat on for Minnesota HIMSS board. I'm also the Chief Nursing Informatics Officer for Mayo Clinic. And I'm very happy to introduce our keynote speaker today. My esteemed colleague, Rita Khan. Rita comes to us. She is as our Chief Digital Officer. Rita is responsible, together with her physician partner, for Mayo Clinic's digital strategy and establishing Mayo Clinic's Center for Digital Health. Her team is developing a cohesive digital strategy to move Mayo Clinic towards a set of digital standards that provide a seamless digital experience aligned with our culture and our values. Ms. Khan was recently the Senior Vice President of Consumer Digital at United Healthcare, where she directed enterprise-level digital strategy. With more than 20 years of experience in retail and e-commerce, Ms. Khan has a deep data-driven digital and omni-channel user experience working for strong consumer brands. And this includes Best Buy, Target, and Macy's. And with that, I would like to welcome Rita Khan as our keynote. Thank you.
Well, thank you, Sharon. Hopefully everyone can see my screen. Like a good digital steward, as well as a champion for consumer experience, I like to start each and every day reading patient and employee feedback. It helps ground me in what's important, who I serve, what's working for them and what's not working for them. So I'd like to start this talk with feedback that we've received from a spouse of one of our patients leveraging remote patient monitoring. And what he said was, during this dangerous and unsettling time when we couldn't visit a doctor, this was a lifesaver for me and my wife. So thank you. Now, prior to the pandemic, while there was significant interest in digital solutions, adoption was still relatively low. But as you all know, due to COVID, there's been a seismic shift in awareness and acceptance of digital health solutions by the general public. A significant component of this was a need to increase safety, of course, and also payer reimbursement and easement of regulations, clearing the path for patient and provider adoption. But despite these advancements and adoption, patient experience connection and tech issues, especially in more rural areas, make delivering digital solutions more challenging. But awareness and acceptance of these solutions by patients and their family members will turn into an expectation after the pandemic. And like every industry, these expectations of access, experience, and simplicity will be compared to other digital experience outside of the healthcare industry. So what did we learn here at Mayo Clinic during this time frame? Mayo patients, and this was a bit surprising, but Mayo patients reported a strong feeling of connection with their virtual care providers, and they felt they achieved their goal of their appointments. And think about it, when you go in to see a physician right now, oftentimes, or not oftentimes, every time someone is wearing a mask. And in virtual, because you're behind the screen, you're able to express yourself. And that's something that we didn't really consider as we thought about the need for virtual care. Now, while it's also important to note that there was lots of resistance by physicians. So this has been a turning point in terms of physician support of virtual care. Nearly half of our doctors surveyed currently using telemedicine said they're achieving better safety and efficiency and more comfort with this standard. Also, 90% of hospitals will leverage more telehealth programs after the pandemic. More than half of consumers said that after the pandemic that they would like to switch to this format permanently to treat their chronic conditions. But there are challenges, as I mentioned. Reimbursement rates are 20 to 50% lower than comparable in-person care. 26% of homes currently lack broadband. But despite this, there's an opportunity for Mayo Clinic and others to perfect and scale virtual options accelerated during this time frame to meet growing consumer need. We also need to invest in website manner, not just bedside manner. And we're focused on accelerating and establishing Mayo Clinic model of care digitally, which will be incredibly important for us. Overall, digital tools reach patients where they are, providing quality remote care and help preserve hospital access for those who need it the most. So what have we done during this time frame? Well, we've been focused on safety and quality and also balancing digital technology with compassion. Video to home appointments are up from 2,700 to over 200,000 from September of last year to this year. Inpatient video isolation programs connected care teams to patients through tablet use, limiting exposure and preserving PPE, which is incredibly important. This service was used more than 48,000 times through September. We also had 24/7 care team access and symptom management accessible through remote patient monitoring, serving more than 5,000 patients using this program between March and July. We also saw an increase of patient online services to provide medical records, notes, prescriptions, and self-service tools through our patient portal. We had over 133 patients use our screening tools via this patient portal. We also had access to Express Care Online, which was expanded to all of our sites and reconfigured to include COVID-19 conditions. This supported social distancing, connected patients to care in rural communities, and preserved hospital access. And finally, e-consults were expanded to allow providers to access expertise of Mayo Clinic specialists across all of the sites and disciplines, serving over 5,000 inpatient e-consults. So what's next for us? Across the full continuum of care, Mayo Clinic and its telehealth team provided care to hundreds of thousands of patients in a variety of ways. COVID-19 has absolutely disrupted the healthcare landscape, but this is an opportunity to reset, add new capabilities, and move forward more quickly. Patients' perceptions of experiences have improved, but the bar continues to rise. We will leverage this learning and will continue to invest in digital solutions that advance care, improve access, affordability, and experience. We're also planning to change how we work. We have proven we can be agile and hyper-responsive during this time frame. Now we'll be focused on bringing solutions to market with similar speed in more sustainable ways, leveraging partnerships, world-class talent, product management, and agile principles, and constant patient and provider feedback. To close, I'd like us to bring us back to another comment that we've received from our patients that I think really captures how digital can help support. Everyone was so kind and encouraging. It was my lifeline. Tremendous peace of mind while I was dealing with COVID and knowing that I wasn't alone. Sharon?
Thank you, Rita. It was a great presentation. And if you don't mind, if we can do a few discussion questions with you. I know there's a lot of interest in the audience. You do bring a very unique perspective to healthcare, given your background with Best Buy and Target and Macy's. So I'm just interested from your retail perspective, how do you envision that we shift the mindset of healthcare teams who've never experienced that? How do we really embrace the patient experience in all their interactions? How would you bring your retail experience to Mayo Clinic's patient experience?
What I love about Mayo Clinic is that the needs of the patient come first. So there's already this orientation of patient, we'll call it patient centricity. And coming from retail, there's a deep orientation to consumer centricity, which is very similar. But what I would say that I learned from the retail industry is how important it is to not just be focused on the needs, but also to design the solutions with feedback baked into those processes. So making sure there's constant provider feedback and patient feedback built into the measurement strategies before you even begin to build your solution. And as you start to receive feedback, good or bad, making sure that you have the mechanisms to adjust real time and be responsive to their needs.
Very good, thank you. So what does the future of consumer experience at Mayo Clinic look like in your mind? You know, Mayo Clinic has a very visionary 2030 plan around Cure, Connect, and Transform. And in your mind, what does that look like? And how do we reach our patients in the world of 2030?
While I'm oriented towards digital, I think the future holds a hybrid between digital and in-person care, whether it be autonomous, virtual, or inpatient. And I think the focus needs to be on having the right solution at the right time that drives the right outcomes. And so this hybrid model, I think, is going to be really important to create a seamless, easy to engage, more transparency from a consumer perspective, and empowerment, which is going to be incredibly important. When I think about the future state of Mayo Clinic and our digital solutions, I'm thinking about how do we build solutions that drive a long-term relationship with our patients. We have a tremendous amount of content that we provide for our care seekers. And in fact, this year we'll probably have over 1.4 billion visitors to our website to research conditions. How do we leverage those touch points to have a deeper relationship with new products and services to extend their care and extend their wellness?
Very good. Yes, I like that. With our destination medical centers, seeing patients from 130 countries, that to be able to have that connection and that lifelong relationship with our patients is just, I love that notion that brings a great perspective. Thank you.
And I think, Sharon, you bring up a really good point too. With the rise of virtual care, it really extends our ability to serve our international patients and to grow globally.
Absolutely, absolutely. So how do you think some of the changes that were enacted during the COVID pandemic can shape our Mayo Clinic functions post-COVID? How would we build on that shift? As we all know, there's been regulatory constraints for many years on telehealth and the like, and so we've really struggled in the healthcare space on how to really execute on telehealth strategies. So how do you envision that we can build on what we've learned?
Well, so as I mentioned before, there's going to be pressure from patients directly to continue this mode of care. They've now experienced it, and I think that's going to play a really important role in terms of sustainability around regulations as well as on the payer side. I think the key is for us to really understand how to integrate this more consistently, more seamlessly into our workflows. I think we've learned a lot, but we have to make sure that we're looking at serving up these right solutions at the right time. And as everybody probably knows on the call that's in the healthcare space, this is not easy to make sure that we're doing this. It requires more investigation, more research. We're obviously looking at affordability, return on investment, as well as health outcomes. And so we're still learning through this time frame, and we'll continue to learn. But I believe it's here to stay. And so we need to continue that investment. I joined Mayo Clinic earlier this year, but Mayo Clinic has been investing in digital solutions over the last 6 to 8 years. And those investments made it really critical in terms of how we responded to this pandemic. But now we're looking towards the future in 2030 and how to use our learnings here as well as the data that we've acquired through this experience to continue to optimize.
Yes, and I would completely agree. I think Mayo Clinic was definitely poised for to be able to execute on this telehealth model. So they've definitely for years been building that. So you talked a little bit about having agile teams and the different product lines within the Center for Digital Health. How do you envision agility? You know, Mayo Clinic's been in existence 150 years, has a long history. It's a very large organization, very matrix. How do you envision that we bake agility into our everyday work?
Yeah, that's a really good question. And I think it starts with being oriented towards the consumer. In our case, it's being oriented towards the patient. And that's the first step. Understanding their needs, understanding how to better serve them is the first step of continuing to be agile. Again, I think our experience through the pandemic has made it very clear, I think, to us that conditions can change, market forces can change, and of course there's a lot of change with technology that we're experiencing within our space. I think that there's a generalized understanding that the agility that we've gained through this time frame has to be sustainable into the future. And so what I'm thinking about, what I'm working on is how do we ensure that everyone across the organization has that agile mindset, that has that constant learning and willing to look at every process and every outcome with new insights and the willingness to adapt and change as needed. And of course, it takes everyone to move towards that agile mindset. But within the digital organization and in partnership with our IT organization, we're very focused on moving more towards a product management model as well as moving towards agile.
Very good, very good. Thank you. Well, Rita, I really enjoyed this time together today in this conversation. I'm sure our audience did as well. I really appreciate your time. Thank you very much. And I'm going to toss it back now to Scott for the next portion of our presentation.
Thank you, Sharon. And thank you, Rita. That was fantastic and much appreciated. And we enjoyed your insight greatly. Right now, I'd like to take a second to thank AWS for its sponsorship for the event today. AWS was a huge partner in working on this event, so we appreciate that. And we're very fortunate today to have Dr. Shez Partovi join us to give a presentation. He's going to spend 10 minutes talking about. Dr. Partovi obtained his medical degree from McGill University in Montreal, Canada, and completed his neuroradiology training at Barrow Neurological in Phoenix, Arizona. Dr. Partovi transitioned into executive roles at Dignity Health, where he served as Chief Information Officer, as well as the Chief Digital Officer, SVP of Digital Transformation. Currently, he joined AWS in 2018 as the worldwide lead for healthcare, life sciences, and genomics. Shez, I'll turn it over to you.
Terrific. Okay. Just sound check. Scott, can you hear me okay?
Yep, can hear you great. Thank you.
Wonderful. Well, thanks, Scott. And of course, thank you to the Minnesota chapter of HIMSS for this opportunity and this terrific event. What I want to do is really spend a few minutes and talk to you about some of the market signals that we're seeing around cloud adoption in healthcare. I have a unique opportunity to really see this from across Canada and the United States and North America here, as well as from across the world, whether it's in the UK, Singapore, South America, you name it. And really, we see a great set of commonalities, which I thought I'd share with you today and then talk about them very briefly. Really, there's three things. As we look at what health systems across the world and are trying to do, they sort of bucket into three things. And those three things we'll just touch on very briefly today is we see a desire to predict health events, this idea of being able to not just have real-time dashboards that show you what's going on now, but rather to be able to look into the future. Then there is this, a lot of, Rita talked about personalization and sort of the convenience factor. There's a large push across the globe where this idea of personalizing the consumer health journey, where patients, members, citizens are all saying, my best experience anywhere is what I expect everywhere. And so that's resulted in this push towards personalization, and we're leaning in to support that. And of course, no surprise to each of you that protecting the clinician experience is a big topic across the globe, and I'll share a thought or two on how we're helping there. So these sort of frame what we're seeing in terms of cloud adoption. Now, predicting health events, it really sort of starts with data liquidity and creating machine learning models. But what I really wanted to share with you isn't about the technology of machine learning or sort of how to create interoperability. But what I want to tell you is that what we see is the exciting transformation that happens in organizations that embark on using machine learning to predict things, predicting length of stay, predicting readmission, predicting transfer to ICU, predicting asthma attacks, predicting congestive heart failure, predicting diabetic retinopathy. Once organizations begin this idea of how do I go from data to information, information to knowledge, knowledge to insights, insights to prediction, we see this thing where three lifts happen. And the best example I can give you is for Beth Israel Deaconess Medical Center and then their journey of moving data out of Epic into a data lake and then building models on that. And what happens is that typically organizations start with this, what we call the first order lift, which is there's stuff that they're doing, and then they just want to do it faster, cheaper, better. Beth Israel Deaconess Medical Center, everybody does OR scheduling. OR scheduling is complicated. You know, some ORs have negative pressures only for orthopedics. Some ORs are big or small, certain equipment fits. Some surgeons like length of ORs to be so long. Some procedures are such. And today, individuals that are savvy at OR scheduling do it. And Beth Israel said, you know, we just want to do that better. And so that was what really started the discussion. There was another thing that we see is that organizations also sometimes want to do things that they know it's on the horizon, on their strategic roadmap, but they quite haven't figured out either technology is too expensive or not available yet. And that's another area where things that you want to do, but you haven't started yet. But that's not the most exciting. The most exciting we see is this third order lift, where they start doing things they never imagined because they began the journey of machine learning and creating prediction models. And so, for example, Beth Israel wanted to optimize our scheduling check. Our machine learning lab worked with them. They did that. They knew they wanted to predict clinic no-shows. The sort of technology roadmap wasn't obvious. Once they began to liquidate the data and put models on top of that, they built a model to predict clinic no-shows. But the exciting part was when, you know, an anesthesiologist at one point in the pre-op area had to cancel an OR because there was something in the chart. And then as they were having that discussion, turned to the informatics and said, why couldn't we have predicted that this OR is going to get canceled? You're doing all this other stuff. And this third order lift, these things that you don't think about, but as you begin the journey are often the ones with the highest return and the most impactful on patient care, patient experience, and other things. And so that's an example of why it's exciting to see organizations start the journey because we know that what they start with isn't where they end up with, and all the initial use cases typically are exciting, but the most exciting, the second and third order lifts come behind it. All right, let's turn our attention to personalizing the health journey. Rita talked about virtualization of care. I won't touch on that. Absolutely, that's a key element of personalization, this idea of my care, my way, wherever I am, meet me on my own terms. But what I wanted to share with you here was a really great example of using machine learning to personalize the journey. And the best example I can give you, one that I really love, is breastcancer.org. What they do is, in a private area of their web properties and their website, when you create a private account, individuals that are members can upload their pathology report. And what breastcancer.org does is uses AWS's technology to actually read the report and extract knowledge graph from that to understand the diagnosis, the pertinent positives, pertinent negatives, the various different things that are related to the path report. And then their web property gets personalized to your specific cancer. Is it hormone sensitive? Is it not hormone sensitive? And what kind of content is ideal? So even going beyond obviously a website that's specific to breast cancer, then to enter a site with content that's specific to you and your cancer is an example of using machine learning to ultra localize, ultra personalize the experience of an individual with using machine learning. So that is really one of my favorite examples. We could spend all day talking about personalization of consumer health journey, and certainly telehealth is a key part of it. But I wanted to give you something that maybe you hadn't thought about or heard about. Again, on that, building on the theme of using AI, ML, and data and personalization. The last thing I'll talk about, which some of the stuff we're seeing, is this the goal of every organization, and actually almost every health tech company as well, is how do we protect the clinician experience? And so voice is clearly a big part of that. AWS is leaning in with incredible voice technology, and whether it's working with Cerner, working with Epic, working with Athena Health, working with organizations like Houston Methodist, we are helping bring, I would say, best described as ambient awareness, so that we can allow clinicians to focus on that patient interaction. And I love the way Rita started and ended her presentation on that patient centricity, which is really to bring the joy of medicine back. We know we need to bring AI tools that are around voice, around next best action, around video, automation, natural language processing. These will all help clinicians to really focus on that crucible of that moment between a patient and a clinician. And so, as I mentioned, whether working with EHR companies like the ones I mentioned, or working with health systems that are doing de novo innovative things inside their own four walls, we're working with health systems from Australia to UK, from the United States to Canada, to help really protect the clinician experience and bring the joy of medicine back. So taking, and really the holy grail is to really help eliminate the keyboard and mouse. I mean, that would be the ultimate, that circle of trust between the patient and the clinician is devoid of any technology whatsoever, any visible technology whatsoever. So this sort of sums up, if you will, some of the signals we're seeing across the United States, across the world, and the way in which we're leaning in to help as organizations shift to using cloud technology to address what they're seeing as both pain points and opportunities, whether predicting health events, whether operational or clinical, to personalize and ultra personalize the consumer health journey, and or help protect the clinician experience. So these are the things I want to share with you today. I really appreciate, again, the time that you afforded me. And again, thank you so much to the Minnesota chapter for this event. And Scott, I'm going to hand it back to you.
Thank you, Shez. Thank you. It was a wonderful insight. We really appreciate you taking the time to join us today, too. We know how busy you are, so this was wonderful. So thank you so much.
My pleasure.
At this time, we're going to invite back in the rest of the panel to everyone to turn on their cameras if they could. And I'm going to pass it over to our esteemed panelists as well as our moderators, Betsy, and I think Sharon. We're waiting for Sharon. There's Sharon coming on. And Chris is hiding himself with some secret, something secret was in front of there. So, all right, I will turn it over to you. And it's wonderful to see everyone on the screen today. So thank you again all for joining us. So Betsy, Sharon.
Thank you, Scott. So that was excellent presentation. So now we want to move into the fireside chat portion of our webinar today. I really want to thank all of our executives for taking time out of your very busy schedules and the important work that you have, not only around COVID, but all of the other initiatives. So thank you very much for your time today. So Betsy and I will do a bit of a roundtable with some discussion questions, but we'd really like to start out with each of you with an introduction, and then if you could follow that up with, what would you say your top strategic priorities are right now that are top of mind? And I'm not trying to play favorites here, but I'm going to start with Chris Ross from Mayo Clinic because Chris does have a conflict at noon. And so, Chris, if I could pass this question off to you, I'd appreciate it.
Hey, Sharon, thanks for the question. And I would note, you all asked for a fireside chat, so I even supplied a fire today to do my best. So I'm CIO at Mayo Clinic, privileged to be part of this panel, also deeply engaged in the HIMSS organization. Biggest strategic challenge is maintaining Mayo Clinic's ongoing operations with respect to patient safety and success, and aiming us towards 2030, and trying to keep those two priorities balanced.
Very good. Yes, no easy feat, for sure. So Chris, how would you say the COVID pandemic's transformed your approach to technology going forward?
Well, you heard a little bit about it from Rita. You know, we were at probably 2 to 3% of our visits were virtual pre-COVID. We went to something like 85% at peak, and now we're down, quote, to only about 10%. At the beginning of the year pre-COVID, someone said, how do you feel about tripling or quadrupling your virtual care volume? We'd say, sounds like a big stretch goal. But we were able to get there. So virtual care is really here. I think what we've really figured out is how to think about it as a adjunct to and a support for traditional visits, and not necessarily a substitute for traditional visits. So as Rita talked about, the hybrid kind of approach. The other is a lot of people are working at home. At peak, we had about 30,000 people working at home. We're at about 15,000, and Mayo's made the decision that, you know, we learned a lot from this, and we are going to move towards a model where people who are not involved in patient care will primarily be working from home. So we're thinking a lot about how to support virtual work. There's probably some other stuff, but those are the two big things. How does virtual care become even more real? And how do we support a distributed and virtual workforce?
Very good, Chris, thank you. Enjoy hearing your perspective on that. So Betsy, let me hand this over to you for our next question, our next panelist.
Excellent. Thank you, Sharon and Chris. So up next, we have Julie Flashenream, who's the CIO of Hennepin Health. Welcome, Julie. If you could do a brief introduction and help us learn a bit about your key priorities right now, and then we'll ask you your question.
Sure. Thanks. I'm Julie Flashenream. I am the CIO at Hennepin Healthcare. I think from a strategy perspective, there's probably 3 different pathways we're going down, 2 very similar to Chris, right? So we're looking at, with going to virtual, how does that stay? And we are taking that and have started doing some studies as also bringing equity into the conversation. So as we were going through the first parts of the pandemic and really moving quickly to virtual, we started doing some studies with our patients around equity conversations, both from a language perspective and culture perspective, and the impacts to that, and really starting to look at how do we provide those services that are equitable across our entire patient population, not just people that speak English and are the way we think about it is easy use conversation. So that's one of the things they're trying to do, and that's forcing us to think outside our box, because it's problem solving for different reasons, and I think it'll help us get to where we need to go, where everything else is. 2 is there's just some base things that we need to get cleaned up and really improve our I guess our foundation so that we can be more agile as things are changing and quickly. We were able to focus and really deliver quickly during the first part of the pandemic, but we also highlighted a bunch of areas that, while we really need to get those things cleaned up so that we can continue to adapt more quickly. And then the third part of that we're looking at is, again, with the virtual workers. We've made the same decision, or we're moving towards that same decision of, if you're not with direct patient care, need to have that face-to-face, probably will be staying home. And so how do we support those folks, both from a standpoint of a technology, but also how do we help people learn to manage in a different environment, how to communicate in a different environment? How do you build that culture when you're not seeing each other on a regular basis, and the different processes that need to go to effect? So I think those are probably the three main things that we're looking at.
Yeah, absolutely. Thank you for that, Julie. So we're curious to know a little bit more, in particular, given your health system is inner city, safety net based, how has the way that patients engage with your health system changed during this time? You talked a little bit about, really thinking differently about equity as part of the solution, but maybe you can elaborate a little bit more on some of the successes or how things have changed.
Yeah, so very similarly, right, we went from almost all face-to-face to almost all virtual in a 3-week time period. And then as we started bringing folks back in, we're still sitting probably around 15 to 20% of our patients are still in a virtual manner, but continue to focus on making that easy to use for both our care teams and for the patients, and then really tying in the modality that they use. So it's maybe not going to be sitting in front of a computer, right? Or how do we connect with, we've changed a lot of things about where we go out to reach out into the community. So things around homeless shelters, and how do we think about that in a time of COVID and trying to keep those things separate. We built our, we have a viral clinic downtown, but then how do we expand that out into the community, different areas, so that we're trying to address those issues and then also connect in with services that people may need depending on what their situation is, right? So there's a lot of different components of that, and doing a lot of actually care over the phone as well. And so for some people may not be able to do a virtual visit. So how do we start thinking about those in different ways that they can? And then how do we bring interpreters into that conversation, or actually even change our offerings, right? So originally when we started, the link that you got, everything was in English. Well, about, I think it's 35% of our patient population, English isn't their first language. So how do we start thinking about that in a different way? And so we had to build tools and techniques around that, and to allow things to change probably more quickly than we would have thought about doing it if we would have been in our plan to roll out, right? As we look at that.
Excellent. Thank you, Julie. Appreciate your comments there. Back to Sharon for our next panelist.
Thank you, Betsy, and thank you, Julie. It's always interesting to hear from your perspective. Hennepin Health obviously was dealing with the pandemic in a very different way than some other sites. So you really had a different population to serve for sure. So our next question is to Muli. If Muli could please introduce yourself, and also if you would address our same question, our high-level strategic priorities that you have for your organization.
Absolutely. Let me first start with the gratitude. Thanks for this opportunity. Absolutely appreciate, and it's a great panel and a lot of great colleagues on the call as well. So good to see you all, and thanks for the opportunity. So in the little introduction about me is I'm the CIO for Optum Health. I've got dual roles in the enterprise. I'm the CIO for Optum Health, and I'm also the Senior Vice President for Enterprise Clinical across United Healthcare and Optum businesses, which is a true United Health Group function. So I play dual roles in the enterprise. And the strategic priorities, and so before going to the strategic priorities, I got to take like 30 seconds to say in terms of with the multiple, I know that Chris hits on it, Julie hit on it with the global pandemic that's happening and everything around how United Health Group continue to be profoundly focused on in terms of helping not just our employees, the members and the patients that we are focused on, but continue to help the communities that we are privileged to serve across not just across the country, but across the globe that we continue to focus on. That's I know that's on top of mind to almost all the leaders on this panel, as well as many others as well. So with that in mind, the focus for 2021 from my standpoint is going to be on three major strategic themes. One is, how do we integrate seamlessly the health data supply chain? And what I mean by that is, I believe that I don't know if data is no longer the health problem. It's the broken supply chain of healthcare is an opportunity, huge opportunity for all of us. And how can we make sure that we build seamless points how to build this health data supply chain? So that's a significant focus for us in 2021. And absolutely, like Chris and Joel mentioned, the virtual world, and how do we create both virtual and in-person models in a meaningful way so that the members and the patients can get the care at the best setting that they deserve to get it. It could be at home, it could be at a hospital setting, it could be at the physician office, wherever the best care can happen. We need to enable all the needs and wants of that to enable care happen at the best possible place for the members that we privilege to serve. That's number two. Number three is talent. And what I mean by talent is we talked about health equity before, and how do we advance our talent with inclusion and diversity as the core of it? How do we create a talent advancement agenda with inclusion and diversity as the core? And how do we bring in healthcare equity to it? And including all the disparities that we have, the inequalities across the globe, how do we bring all of that together to get diverse perspectives so that our workforce and everything looks exactly like all the communities that we are privileged to serve? So these are three major priorities we are focused on and have a myopic focus on that. So thank you.
Very good. Yes, that is a major focus for us at Mayo Clinic as well, diversity and inclusion. And so how can we really extend our reach as far as our employee pool going forward? So that's really good to hear you say that. So I think you may have a unique perspective on this, but how do you see your teams potentially either coming back to the office or remaining as teleworkers, if that's the situation now? And if so, how would you ensure productivity? How do you plan to measure that?
So I'm assuming, Sharon, that question is to me?
Yes, I'm sorry, Mila, yes.
Okay. Yeah, so it's we never planned for this, right? So we never, I thought we will plan a disaster recovery for a tornado or something hits one of our data centers, it's out. We never planned a global pandemic is going to come and never planned for this. But that's why good planning helps. We were able to, within weeks, get 90% of our workforce, which are non-clinical workforce, work remotely during this pandemic, which is unbelievable. If you look at United Health Group broadly, we have 325,000 employees worldwide across many countries. To get 90% of the non-clinical workforces work remotely and virtually across continents is no easy task. And we were able to significantly do that. And not just do that, but also have a huge way in which the productivity has significantly improved. And there are many perspectives on the productivity significant improvement that we are seeing. There's a 30% improvement from last year's story points to this Q2 story points development. I literally see a 30% improvement in number of story points the teams created, which is phenomenal. And again, that's what there are multiple contributing factors because people are not taking PDOs, people are not taking vacations. There's no else to do, so people are working. There's many perspectives each one of my leaders are sharing. But I strongly believe the pandemic created a purpose for the workforce. It created a single purpose in terms of helping people that are in need. And that common purpose, you could take any companies in this call, I think the common purpose united a lot of folks in a more meaningful way to the enterprise's mission, that we started seeing a significant improvement in productivity. We saw seeing a significant improvement in productivity. Now, I wanted to secure a dream that's going to be sustainable, and we could continue to drive it, but I also know the reality is going to sink in, and rightfully so, that we'll create a balance out. But one great thing this has created, the silver lining, if there's one, a lot of organizational decision-making bureaucracies have been broken. And the walls have been blurred. The people who have to make a decision and the people who need the decision, the channel of communication between those two parties have thinned, have gotten so closer that the decision-making happens at a rapid pace. Decisions are happening, and the product is getting delivered in weeks, not in months. So in a broader way, your question around, what is our, how are we able to keep people virtual, and how is our productivity? Hope that touches it.
Yes, thank you. Thank you. Very good. And thank you for providing the snowy background. It's a great accent to Chris's fireplace over there.
Fireside, I know.
Yes, perfect. Thank you for bringing the snow. So, Betsy, back to you.
Thank you, Sharon and Muli both. Next up, we have Dr. Samir Badlani, who is the CIO at mHealth Fairview. Same introduction and strategic priorities that we'd like to hear about from you first, Samir.
Absolutely. Thank you for having me. Appreciation to the group and Minnesota HIMSS chapter as well. Chris, I'm very impressed with your background. I've never understood why CIO Fireside Chats are called that. Given we are in technology, I don't think we were next to fires at any point in our professional careers, but thank you for that. One of the challenges going somewhere in the middle is all the good things have been expressed, so I'm going to try very hard to come up with more interesting things, or at least equally interesting things. Nonetheless, the biggest focus we have at mHealth Fairview is affordability. Healthcare is going through a severe crisis where the healthcare as a product that we are putting out there between the insurers, the providers, the pharmaceuticals, the med devices, and all IT companies that are associated with it, that consumes 17% of the GDP. And if you look at the average healthcare consumer, they are on high deductible plans, and they don't even run up the deductible portion of their plan at the end of the year. So there are a lot of out-of-pocket expense that my organization is trying to take leadership in trying to transform. So when I think of my role as the Chief Information Officer, also responsible for the digital transformation of the organization, we try to put that front and center for what we are trying to do here. The second bucket of our major focus is on the consumer, the patient, the customer in front of us. So I try to divide that up into the experience, the equity aspect of it, and then also what is the outcome that the patients are getting. It's really important. All of you had wonderful points about digital has given us another avenue, but what is the experience you get when you have virtual care versus in-person care? What are the outcomes, as Julie mentioned and others have mentioned? And I think those are things we should not forget. And having proudly served in some of the many low-income areas of Chicago and some of the strained areas of California, I can tell you that digital has an opportunity to improve the outcomes for these communities. But if we don't focus on it, we don't think about it, we will land exactly where we are in pre-COVID state, where everything we do is good for some people, but it's definitely not good for all the people we would like to serve. So that's the second bucket of strategic focus we have. And the third one, Cher spoke about it, provider burnout. As a ex-clinician, or well, I shouldn't say that, as a clinician myself, I have a global virtual concierge practice now that I don't charge for. It's all pro bono. So I still am a clinician, but there is tremendous physician burnout. And I think, COVID has been good for productivity on IT teams and other teams, but there are a lot of physicians who are actively thinking of quitting the workforce. And I'm sure all of you in your organizations hear stories about it. And this is not something new. COVID has just made it worse, the insecurities and the work challenges that come with it. So we like to really make sure that as we think of anything we put out there, we think of these major three strategic buckets. What does it do for affordability? what is it doing to equity and outcomes for our consumers, and what is it doing to our providers, because we are continuing to burn them out in the way things are designed right now. And this is not just IT, this is our healthcare economics, it's a regulatory system. Everything adds together, unfortunately, to create this ecosystem. So I firmly believe that technology and digital transformation has the capacity to change that. Otherwise, I wouldn't have given up practicing actively. So this is what I hope to contribute along with my team.
Thank you, Samir. Test to Dr. Badlan, virtual as he's been very helpful at times with myself. So Samir, we are curious if you could elaborate on what you've been talking about care and telemedicine, and what do you see that looking like in 2021 and beyond?
Yeah, I think all of us are interested in seeing what the feds and CMS and other insurance companies do with reimbursement. That's going to really define if those of us who are trying to stay at the 25% mark, which we think is a reasonable way to provide virtual services, expand our access, and then also only bring in patients who really need to be seen by a doctor in person. That will be critical. I am also excited to see the amount of innovation and disruption happening in this space. So, we have gone from maybe 1 or 2 video-based platforms to innumerable ones and a startup almost every day. That's exciting. I think that will create market pressures for better products, better capabilities out there. But again, I always have the filter in front of my eyes of not getting too excited by shiny objects. In fact, once I thought of creating an ICD-9 code for that shiny object syndrome that healthcare suffers from a lot. And we have to make sure, it improves on the affordability and actually delivers on value. And then from a CIO's perspective, reduces the burden on my stack that we have to maintain and curate year after year. So from my side, it would be looking at what happens with reimbursement. Secondly, would be the experience. Right now, if you think of a video visit, the physician shows up, you have a conversation, you're just happy that video visit worked, and then it collapses, versus in a clinic, you have somebody rooming you in, somebody rooming you out. So we have this opportunity to redesign from scratch what does a virtual visit look like. So I'm excited to share that I'm partnering with our Chief Marketing and Digital Experience Officer, Scott Weber, and we're really taking a step back and looking at this as a design problem and not just trying to use video-based technologies to replace brick and mortar and assume that the experience we are giving now in brick and mortar was just right, and all we have to do is replace the medium here, but then also to take advantage of what technology can offer. It's my personal reflection on the electronic health record journey. That has proven to us that all we did was use technology to replace paper processes, and that's why there is such high level of dissatisfactions across the board. So let's not make that same mistake, is what I try to tell myself.
Wonderful. Thank you, Samir. And, I really appreciate the holistic sort of approach that you described there, as other CIOs are as well. As I sit and reflect on the comments here, I think some of what's been missing in the past was that it was a technology problem, right? And we failed to look at the broader picture. And it's exciting to see organizations really leveraging all the components around this to do something better for our patients. All right, thank you. And Sharon, back with you, and hopefully Mark is here.
Yes, thank you, Betsy, and thank you, Samir. Very good points. Yes, we need to focus not just on the technology, but the people and the processes. So we know it doesn't work well if we don't include all three. So I'm not sure if Mark it can join us.
I am.
Like oh, are you on? Okay, great.
I am here. I have to apologize. There's always got to be one of these panelists that doesn't get the video right.
No problem, Mark. So thank you. So if you could introduce yourself to us, we'd appreciate that. And also, if you would also share with us what some high-level strategic priorities for your organization in the coming months and years.
Sure. I'm Mark Wayne. I'm the Executive Vice President and Chief Information Officer for All True Health System, which is located in Grand Forks, North Dakota, and we're right on the border of North Dakota and Minnesota. So we serve the region kind of in Northeast North Dakota and Northwest Minnesota. And, you know, when I look at the strategic items that we're working on or focusing on in really the next year since COVID started, a lot of it is a little bit redundant with what I've heard from other folks talk about. You know, one thing we're continuing to work on appropriate access for our patients. How can we best get our patients in to be seen with the providers? And of course, the virtual visits is really going to play a big factor in that. As we try to hardwire all of the work we've done as we've rolled out our virtual visit platform, we want to make sure that we're standardizing those processes to really become or provide that best patient experience that we can. You know, it was really a concern that a lot of our providers had prior to COVID, was they were just worried about that patient experience when they do a video visit. So we want to make sure that as we continue to use those virtual visits that we're evaluating, we're monitoring, we're making that experience consistent from provider to provider so that we're really doing all of the things that we need to do to make that a good contact with that patient. I think also we want to make sure that we are providing those low-cost options. You know, I think I was reading an advisory board report that was done since COVID, and they talked about of the people they surveyed, I think 1 in 3 has had some sort of employment interruption, whether it was permanent or short-term, which kind of impacts that insurance side of it. So again, we want to make sure that we've got options out there for our patients to get the health they need. I think the second item that we have on our list is just the, and I think Julie had mentioned something about this, but just that collaboration. As we've got more people working from home, it's been a real positive for us. So I think our staff have probably been more productive. When I look at the IT side of things, they're not driving back and forth between the different facilities we have for all the meetings. But it creates a challenge for us too, because we used to be able to get them all together and visit with them, and you had that face-to-face connection. And it just makes it a little bit harder to keep connected with them, and we want to make sure we keep them engaged and happy. So we've got to be able to use those collaboration tools well to be able to keep in touch with them. I think the last thing that we have, and I think it was on one of our questions, there were questions surrounding this, but I think just keeping all of our systems secure. We've got so many new and different touch points now with connections to our systems that it's just something that we need to really be diligent about to make sure that we're monitoring, that we're providing appropriate training for people that are accessing our system, that we've got the appropriate vendor support that's working with us on this, and we just do that diligent monitoring.
Very good, thank you. So Mark, you sit in a unique space, having a lot of rural sites. Can you just give us a sense of, from what you experienced in COVID, were there any challenges or aha moments that you might have experienced that were different than, say, what Julie might have experienced in an inner city, more of an inner city perspective?
Well, so we've got regional sites that are Altru owned, but we also do a Community Connect program where we've got 13 affiliates that are out there that are really rural facilities. And so we heard early and often the help that they needed out there. You know, all of these nursing homes, they're being totally locked down, and not all of them had telemedicine connections to them. And so that was one of the things, as everybody touched on, being agile and how rapidly we were able to roll out the telemedicine or the virtual programs. We were doing that in a similar fashion for all of these remote areas to make sure that as they were trying to keep those patients safe in the nursing home, that we could still provide that health care to them and helping those facilities with that telemedicine connection back and forth to them. I think the other big thing for us is that it's always felt like in the past that a lot of things were being pushed up the hill by IT trying to drive it. And I think really since COVID's taken place, we've got more operational ownership in these, which has been just a big relief, because you've got the people that are out on the front lines doing this that are now more engaged and working collaboratively with IT in terms of what is the best solution and how can we push this out faster. It used to be that we were always pushing on people to get things done, now they're kind of pushing on us a little bit, and I think that's a good thing.
So would you say that as the pandemic has evolved, that you have more buy-in from providers from initially how they felt about telehealth and video visits to current state?
Absolutely, we do. You know, we rolled it out to all of our providers across the board in a relatively short period of time, and you know, before we couldn't. I mean, we tried everything to try to entice some of these providers to use it and to try it. And I think initially there was just a little bit of a fear factor on the provider side as well as the patients. You know, the patients didn't want to come in because they were worried about it. The providers initially weren't quite sure, you know, how contagious is this? And so everybody was really willing to jump on board and do these video visits. And I think since we've been rolling them out, I don't think we had the success that Chris, you guys were able to have, but we felt the same way. We were always setting a goal out there, and we far surpassed that goal as COVID hit. And I think since we've been rolling it out, we just have had a lot of providers that have really embraced it, are doing really well with it, and have turned into really champions for us for some of the providers that are maybe a little more reluctant.
Yeah, that's good to hear. They've turned into believers, right? That's great. Well, thank you, Mark.
Yep.
I was anxious to hear how things were going in more of the rural space. So I'm going to pass it back to Betsy, and she's got a question for Alan.
Great, thanks Sharon and Mark. So yes, next we have Alan Abramson, CIO from Health Partners. Welcome, and if you could introduce yourself, please.
Well, I think you just did. Yeah, I'm the Health Partners. I'm sitting here thinking, trying not to repeat what others have said. We're all kind of doing the same thing, and it's great to hear the variety. But I'll mention two strategies that are more related to kind of the internal workings of how we deliver a better experience to the ultimate consumer, the patient or the member. I saw a study recently that 85% of executives across multiple industries say that they want to do a better job in the future of making data-based decisions. So 85% want to go there. The questionnaire said, so how do you make decisions today? And the number one answer, which is about 67% of the people answering, was based on my experience and intuition. And the number two answer was 62%, I think, what my fellow executives and friends are doing. So here we are, where our mission is to deliver data to help make better decisions, and we're not getting the job done. So that's a strategy for us, to line up the data and provide important data. In a nutshell, the data that people need, when they need it, and where they need it. I think that's the new mission of IT after you're running all the systems to keep, the transactions working and all of that. And so if I asked any of you to describe your IT department, what does it do? I bet a lot of us would kind of work our way through the org chart. And what we're doing instead is imagining a value chain. So we've got the platform. I'm a mirror image on the screen here. So let me go this way. Okay. We start with the platforms, the infrastructure. The infrastructure can be on-prem, hybrid cloud, full cloud, cloud first, any of the various versions of cloud, and those platforms will produce, for applications, the foundation that those applications can run on. Those applications can produce the data that go into the data analytics environment, whether it's cloud-based or on-prem or whatever, to produce better results. So we're trying to talk about the value that we provide for the company as a value chain and not as an org chart or a set of positions or responsibilities or that sort of thing. Strategy number one. Strategy number two, retention of our staff across the organization. So the Gartner IT symposium is going on. One of the lead analysts talked about the fact that the opposite of boredom is fearful uncertainty. And what we've got in our environments today facing all of our employees is not one, but actually 4 big uncertainties. We've got the pandemic, which is a health and safety issue. The pandemic is producing economic uncertainty for all businesses and for all employees. And then we've got a big crisis in political social justice going on in every country around the world. And fourthly, we have economic impacts of climate change, and all of these things are uncertain as to their actual outcomes. And so all employees are living in this domain of not one, but 4 big uncertainties. So what we're trying to do is focus on where can we help employees as they're trying to navigate this. Daycare, help for moms that have to take the schooling responsibility as well as daycare and their job. So everyone's affected, but disproportionately women. And what many people are reporting is women are dropping out, not returning back to the workplace. Even when the workplace is virtual, it's hard for women to do all that they've signed up to do. And they've gotten more on their plate than they ever signed up for. So we're asking managers to pay special attention on these video Zoom conferences to the people that don't show up as frequently, or they just have themselves on mute and their initials there, but they're not a full participant in the daily discussions, or they've gone silent on email. It takes a long time to respond, and figure out how, what's going on, how to have a conversation, and see if we can meet those needs of whoever they are, but with a special focus on women.
Thank you, Alan. That was really very interesting, and I especially loved your point on IT as a value chain. Really important to think about that. We are running tight on time, but very quickly, I want to make sure you get your question. And very curious just to know, what are you doing to prepare your teams for the future and what we need in that future generation workforce?
We've been, looking at how we work, the work that we do, focusing on how long it takes to do work, and that the one variable we can control more than anything else is the time it takes to do something. So how to drive unnecessary wait states out of the processes that we do. Continuous learning is the other story. I think we all know about that, but really finding ways to encourage people to be in a continuous learning paradigm rather than a skill acquisition paradigm that it might last for years or for a career. Those days are over. It's now continual learning of new capabilities as we go forward.
Wonderful. Thank you so much, Alan. All right, Sharon.
Thank you.
But
and
not
last
least.
but not least, Robert Booker. Apologize, Robert, that you have to be our last, but I'm sure you have the best to add to this fireside chat. So can you tell us a little bit about yourself and also what your top strategic priorities are?
Yes, thank you, Sharon. Hello, everyone, and thanks again for the opportunity. I must say I'm thankful I'm last because there's so much great commentary already. I could just say what everybody else said and we'd be good. So I serve as the Chief Information Security Officer for United Health Group, and in that responsibility, I have oversight for our security program for the enterprise. So that includes our insurance as well as our care business. Mooley is a great partner of mine in terms of our Optum Health division, and that's a global role. So I have responsibility not only for the U.S. but for our operations in South America and also overseas in India, the Philippines, and Ireland. So in terms of priorities, I look at this the year that was to be and the year that is, and I think prioritization. I look at COVID as an accelerator in many regards, and perhaps a few of us have felt the same way as we've thought about accelerating telehealth and engagement. And so I think our first and foremost priority as we sort of began the journey of ensuring we maintained availability for our nearly 200,000 people that are working from home every day, plus our clinicians across the system who are still seeing patients in a variety of ways, was just to make sure our system remained number one, available, and number two, did not impede the need of our patients and members and those we serve. Said another way, security has to enable our business and be a support to the business imperatives and supporting care, and not something that gets in the way of delivering care, as we've looked at the year that we've been living in. So and I can pick a number of examples from engaging with a large number of telehealth suppliers and partners, to how do we look at interoperability of data across our clinical system, to how do we exchange and interoperate data increasingly across the system with all of you and others. And I think of that as a place that security should rightly not set the tone and the direction of those types of decisions, but we're often seen as a gate or a constraint in terms of how easy or how transparent those processes can be for the enterprise. So a large focus on ensuring that we're lightweight, we're nimble, we're acting as an accelerator and not as a impedance to the operation. I think the second thing that's going to be interesting, and several of you touched on it, is how does not only telehealth but the concept of digital engagement evolve over the years ahead. And we've all, I'm sure, been looking at digital and telehealth as strategic imperatives. I think while we've talked in a number of cases about the physician encounter, the talking to your physician on a screen and having a good engagement there, we asked the question about the entire disease management of the patient, and so it's the physician certainly as the center of the play, but it's also the ability of the system to use the information that's generated through the care continuum to allow us to make sound choices and sustain health and do interventions where appropriate through that. So I think again, we get a bit of an engagement across that, and just thinking about the consumer, not just as an account that's on a different platform for specific products, but as a relationship to be sustained not only across our system, but maybe in the future in partnership with many of your systems. I think that digital relationship and ability to enable health outcomes through digital means is going to be critical. So in the interest of time, I'll stop there. I think the world is bright for the future, and it's been an accelerator. Our job is to help and to protect the company, keep it available, but also not to get in the way and impede where we need to go to serve the people that rely upon all of us.
Thank you, Robert. And we're at time, but you being a CISO, I quickly want to ask you, what do you see as emerging security threats?
I think, I actually think the threats have been fairly consistent, but where they come from and how they come evolves. So I do think, as technology evolves, there's different ways we interact with technology. So open source software is one thing we'd think about, for example, as a risk channel. But I actually think the evolution of the security is the fact that we want those people we engage with to be increasingly close to us in digital channels. And a lot of the practices and the exposures we see are oftentimes oriented in the behaviors of the people we serve. So I think about how do we create good awareness, not only inside of our communities, among our physicians and our colleagues, but how do we actually create those engagements across the system? And so I think awareness and good engagement is going to be the key in how we stay ahead on that.
Very good. Thank you. Yes, good point. Security is all of our responsibilities, for sure. So thank you all for an absolutely interesting dialogue. And I know I enjoyed it. I'm sure our audience did as well. So thank you all for your time today. To remind everyone, this is a fundraiser for our scholarship program. So this is to fund any, and this will be instrumental in assisting emerging healthcare IT leaders in the Midwest. So we ask you to please contribute to our auction, which is still live until tomorrow at noon. So we have some excellent executives that you can buy time with. And so we encourage you to bid on these very talented and intellectual executives. So thank you all for your time.
Thank you, Sharon. Thank you, Betsy.
Thank you all. Scott. Great to talk to you.
Thank you.